Hey everyone, I hope you guys are doing well. I am here just to kind of make another video, but I'm going to tap more into that education side. I know when I introduced myself on my first video, I talked about how I'm really into the realms of mental health and education. I've been definitely hitting on that mental health hard, which is something I'm really passionate about. I'll tap a little bit more into the education today, but it's still kind of intertwines mental health in there. But what I'm going to talk about is dealing with doubts that you feel in a helping profession. So, as I said last time, I recently got a new job. This is my, I guess you could say, third week. It was a short week because it's Thanksgiving break. So it is Tuesday night and my week just ended, so I'm off for the next 5 days, which is pretty cool. But I've, kind of gotten a good amount of time, gotten to know my kids, things like that. And I've already started to kind of train my mind to kind of think certain thoughts so I don't get to an anxious point. I don't want this job to be something that brings me anxiety because I do have literally the best time with my kids. It's a time that I feel kind of like the most at peace, and the good thing about kids is that for me, I never feel judged, and hopefully I bring that same thing for them. And it feels like it was yesterday that I was in their shoes. I feel like I could relate to them really well and, try to teach them the best I can. So the reason why, I call this topic doubts that you may feel in a helping profession is because I feel like a helping profession is clearly different than your typical profession. And I feel like the reason this is because, especially in like a day and age where we're like so into technology and a lot of people, work from home and things of that nature, we don't have as much where you're like seeing what you're actually contributing to, like the people you're actually contributing to, if that makes sense. Like if you're doing like a business job, a finance job, and you're working from home, right? You're putting in those numbers on the computer and you're helping, probably so many people, working with banks, these accounts, those accounts. Like you are helping so many people, not probably, you are helping so many people, but you don't see them. So I feel like you don't get as much of an appreciation or like a grasp of what you're actually doing. Whereas when you're a doctor, or I mean, there's telehealth now too, but like, like ER, and somebody, you are helping them in that moment and you see them and you are helping them, you know who you're contributing to, what state they are in that moment, those kinds of things. Like that's how I feel like, what kind of really, let's just say, like gets my brain going is that I see the child, I'm getting to know the child. I want to know kind of like the whole child, like not just like their academic standings, but tap into the social emotional as well, and kind of how they like to learn, what are their interests, things like that. So I see this whole child, I'm trying to get a scope of them as a person, as a human being, and I know I'm contributing, hopefully contributing somewhat. We're trying to contribute to their happiness, their comfortability in school, their confidence when it comes to both in and outside of school, things like that. So I think that's what really hits home for me, is me seeing and getting to know these children firsthand. So going on with that, like I said, I've already been like pre-training my brain with some things early on to try to be proactive. So number one, what I'm telling myself is that no matter what profession you are in, you're not a magician. Like you don't have a magic wand. Just because you went through X amount of school or you have X amount of certifications doesn't mean you have this otherworldly power to make something happen within someone else. Like sometimes things are just out of your control, and you have to like get to know that. I think it goes back to even what I was talking about in that imposter video, like we put so much pressure on these titles, like, oh, he has a, you know, like a PhD and he is a doctor at this so and so hospital, like he's going to do the best job done. But let's just say like he loses a patient, like some things are just out of your control, and I'm kind of trying to bring that to teaching. I could, you know, I've been trying to take an inventory of the kids' learning styles. How do they like to learn? Do they, you know, is it helpful for them to hear a passage on audio? You know, do they really prefer to have that paper copy to touch and feel and flip, see the words? Do they like to follow with their finger? Do they like, you know, pictures and drawings for math, for that visual sense? Do they like to move around the room, kind of that kinesthetic learning? What helps them the most? Okay, so I could collect that. I could go and I could do research on evidence-based practices. I could collect data and, you know, base my teachings off of the data that I'm collecting. But at the end of the day, I could do all that, and the student still may not be able to reach a certain goal at a certain point in time, because that just might be dependent on them and where their brain is at that point in time. And I could only do the best I can. I could only do the best I can. And another analogy, I know I'm kind of rambling, so I'm going to try to talk a little slower. But today I was with one of my students. We were just doing like typical subtraction. So if you're subtracting like 63 from 29, right? And you go to subtract, and she went to subtract and she subtracted 3 from 9 and she put like 6. You know, she didn't like carry her number, whatever. But I try to explain to her and say, well, we can't take 9 away from 3 because there's not enough to take away. Like if I had 5 pens, you can't tell me you're going to take 10 pens because I don't have 10 pens to take. So what I'm getting at with this analogy here is that, let's just say my brain, my heart, my body, my whole being, let's just say only has 5 ounces of juice to give. I can't push out another 3 ounces. I can't, because that's the best I could do. You can't take more from me than I have. So just kind of remembering that, like, you could only do your best, and just because I'm in this position doesn't magically give me some powers that I didn't have before. Like, I'm still the same person. My best, I mean, I'm trying to make my best better every day, but, you know, my best in this moment is, you know, still like relative, I guess. Like, it's not like I jumped this whole new other level just because I started a new job. I'm still growing gradually as a person, as an educator, as, you know, somebody who cares for children, and that just didn't skyrocket because I got this new position. So just trying to remember that. And I also am trying to take a very selfless approach when it comes to criticism, and I'm going to explain that a little bit. So if I get hard on myself, let's just say in like the beginning of the day, 10 a.m., I get hard on myself that I maybe didn't explain a concept good enough to a student, or maybe in fact I made them more confused on the concept, I feel, because of the way I explained it. I was doing too much. Now I'm kind of checked out and it's 10 o'clock. I have other students I'm working with. I have small groups. I need to go in and, you know, facilitate in classrooms like the best I can. And now, because I just beat down on that criticism, I'm not giving my best to the other students, which is more of a detriment. So I feel like one of the most selfless things you could do in these helping professions is to kind of just like pick up and move on. Like, of course, learn from your mistakes, but don't dwell on them, because one, that's going to affect either your future clients, patients, or students. And number two, it's just an example of you focusing on yourself. I feel like for all the time I'm there, I want to focus on the students. When I get home, that's my time to focus on myself, my family, my friends. But when I'm in that school, it's about my students. It's not about me. Also, accepting little wins and like accepting them as victories. Like if I see maybe a kid who's like normally down and maybe they like chuckle a little bit at something, but they're still not getting, that academic concept that I've been drilling for the past week. Take that little smile, that little chuckle as a win. Because, gotta remember, it's about that whole child. So, gotta take those little victories as wins, and that will help kind of build up my confidence, my morale. And I think that will in turn, kind of result in better teaching as I move forward throughout the day. So just kind of to be observant, take those little wins. On the flip side, be observant and maybe notice when a kid needs, maybe a little more grace for the day. Something I've learned so much throughout this year is you truly should not judge anyone because you don't know what's in their shoes. And I say this because when I was little, I had the luxury, I was laser focused on grades because my parents told me your job, is to go to school and get good grades. That is your job. Come home, follow the rules. But I didn't have any big responsibilities at home. I didn't have chores to do. I didn't have, we didn't rotate cooking dinner, anything like that. So I had the luxury. That was my job. Just get good grades. That's it. Be respectful. Basic. And so I always thought of kids who didn't get good grades and kids who were in lower level classes and things like this. I thought a little more down on them because what else are they doing as a kid? All you have to do is get good grades. I was so focused on my perception of reality that I truly thought that was everybody's reality. But now, especially in the past couple months, interning for counseling and starting this job, you realize that every kid's story is different. Every kid's home life is different. Every kid's responsibilities are different. Some kids go home and they need to watch their little siblings and they don't even see their parents. So, if that looks like cooking dinner or, just making sure they have eyes on them. And then on top of that, they don't have an adult there to help them with their homework. Whatever the case may be, every child's life looks different. So you can't judge based off a report card. And you can't judge based off behaviors. Behaviors are communication. Behaviors are telling you something, most likely, that, there's a reason for it. People for the most part aren't intrinsically bad or intrinsically want to be scolded, especially in front of people. It's just not it usually. That's usually not the answer. There's usually something behind. So you want to look at the child for the child and the behavior as the behavior. And that is kind of like a communication method. Now what's going on behind closed doors? Ending thoughts. Just try to wrap this messy video up in a nice bow. Kind of bring it together. Patience is super important. You have to, I have to remember, and I constantly remind myself, and I remind myself more now when I'm babysitting, which is super helpful, because those are super little. These are my babies when I babysit. Is that, you have to imagine the level their brains are at. I can't even remember what I was thinking in first grade. I can't remember now what a typical day in my mind would look like in first grade because I don't even know what I was thinking. I was up there in La La Land. So imagine getting all these directions at you from your general education teacher, then you go to your resource teacher, then you go to your special ed teacher, then it's a lot. And the school day, observing it now, being a teacher, it is a hard day. It is truly a hard day. They are working. They are. All of these different subjects, and they have, do this problem, sit down at your desk, do this test, do this quiz, read this book, listen to this video. It's a lot. It is. Whatever way you cut the pie, it's a lot. So, even being there is hard. And I realized that in high school. Being in the school setting is hard. It's difficult. It's not something that every child personality is going to mold to right away. Even in 4th, 5th grade, when they've been doing it for a few years, it's not something that's conducive to everyone's personality. And, I think that's something important to remember as an educator. And, what else was I about to say? I think that's it. Even though I have something else in my mind that I was going to say, but I think that's a sign that I have said enough. And this kind of just like a good document. I'm literally a week in, but it was, as you can tell, very eye-opening because I've had a lot to say. And these are things I'm just trying to like train my brain to remember, and hopefully these thoughts will influence my actions, and I'll be, more patient and loving and kind as a special education teacher. So I was very happy to dive into, this role and kind of what the more education side of things looks like for me right now and how that kind of ties into my mental health. Just remember that you are enough, and happy, happy, happy holidays, Thanksgiving to those who celebrate, and yeah, bye.